So hi everybody, I thought we would go through a couple of things that you could give to your patients, some exercises, something that might find interesting. So here's this TheraPutty, we're just using yellow. I like to have that putty where it's easy to do the whole range of motion. Don't make it so hard that they're recruiting everything else, because sometimes we want to isolate just out certain muscles. So here's what you want to do when you get them to do it. You can start to get them to just squeeze a regular grip. That's a nice way to start. People automatically do that. If you want to get it to be a little more challenging, you tell them to do it like a hot dog, so they can squeeze all the way where they're pushing it out the one end and out the other end, and then that makes it significantly harder. The second one that we usually tell people to do is do a hook fist. So the important part about this is if you looked from the side, these knuckles would be flat. So a lot of people want to do this, but if we really want to work the exercise right, we're making it into a hook. To make it even more interesting for them, you could make it into a hook like this and really get them to drag the putty, where they drag like this into that hook. But again, the goal is that if you were on the side, this would be straight, okay? You can get them to do twisting, pulling, and rolling all the way around on that putty. Good bilateral activity. If we wanted to work on the thumb, there's a couple of great thumb exercises you can do. So I tell them we can do it like we're clicking a pen. If you were to look at it from the side, it would feel actually different for the patient too. So they could click the pen right here. The fingers can be bent in this scenario, but if you want to make it challenging again, you do it with the hand is flat and the thumb just comes over. A lot of times the patient's going to want to curl their fingers in. Super important that we ask them to stay flat. That's the important part of that exercise, is just flat hand, and then that really works that thumb beautifully, just like here, okay? The thumb, it can work on just molding and twisting. It's really nice. If you're really clever, you could get them to just kind of work and manipulate into a ball. Now, another nice one, especially if they have an ulnar nerve problem, we really want to do that duck position, the one that looks like this. So we can go ahead and hold our fingers straight, thumb straight, tell them to make a duck, and even challenge them more by making their fingers be wider apart. What they're going to want to do is bring them close together, but you can make them be wider apart, and that's even more challenging for that exercise. And patients generally like the feel of that. That's a good exercise to do. If you're also looking closely at ulnar nerves, then doing where you can go in and out. Patients that are very weak in those intrinsics and their interosseous, so this is a great one for that. And then a great one for this is spreading your fingers apart, and even putting your thumb in there as well and spread apart. So there's actually a little bit of a difference between pushing your fingers out flat or putting them in and spreading them apart, kind of like if you had an elastic band on the end. So one looks like a flat push, one is an opening up. They're kind of a little slightly different. But they can even push the putty. So if you put marbles or pins or something in there, then you can go ahead and get them to drag it out. They can drag it with their fingers together, or just one finger by itself to make it a little bit more challenging. So same with the thumb. If they had to get it out, they have to push it all by itself. So a little bead, a little kidney bean or something, but make them just use that one digit or their thumb rather than both. So another couple of things that work really great for putty, putting it between your fingers. Now the key to this is patients are going to want to go like this. You have to have it flat. If you want to do this exercise correctly, make it flat, okay? It will be hard. Don't make the ball so wide that you can't do it. And then you're going to alternate between each finger, like so. Alternate between each finger. It'll get harder as you go out, and then out here to the baby pinky. Trying to, again, keep your hand flat as you do that. If you make it a little wider, you can have it through the thumb like this. Again, don't let them come up like that. It's actually a completely different exercise. So down like this is nice, okay? You can take the hand to the side of their thumb, or even lower underneath to the middle, even to the little. So you can alternate fingers. It's a nice way to do it, like this, or back to the side. Since you've come into the side, you may as well push it back out. So if you're really wanting to work that thumb, work on pushing it back out, which is really nice. Even pushing it away like this is a great exercise, especially if you put some little beads or something in there and they have to find it that way. They can even drag it back towards them. And And sometimes to make it easy, you can go ahead and get them to push their thumb down like they're clicking that pen, or get them to pull up just like this. Another important exercise is to take your pieces of putty, combine them together, and roll them over the finger. So it looks like this, where you have to straighten up. This one people have a little trouble with. They want to wrap it like this, really bulky, and then just push that up. You want to make sure your finger is bent as you do it. Wrap it around a bent finger like so, and then work on straightening all the way back up. Okay, take it, loop it around the bent finger, all the way up. Take it, loop it around the next finger, all the way up. It gets harder as you go out, and the last finger, all the way out. And of course you can do the thumb. So it's really important to remember not to just do the forward motion, but also do the extension motion. You can put an elastic band around the tips of your fingers if you want to, and then there's a great way to exercise as well. Pulling, again, is not bad, and you can even take your putty and work on doing gripping and rolling. Pulling back, grabbing the putty, grip it like so. You can see from the side, grip it like so. All right. There are a few putty ideas. There's probably much more, but that's just some to get you started. Okay, and we'll do it with a bigger piece of putty so you can do it in the clinic and see some other activities.